Dr. Vienna, could you explain what conductivity of the body means, and how does water and light work together, and how does light work together in the body? And what are acupuncture? What are these points and these meridians? And why is it important that this all works together for our stem cell activation patches?
Well, I think I get to have the best topic because this is so much fun. So first of all, we are connected beings, and that we have electricity and we have energy that courses through our body. And what most people don't understand is that when we are starting to show energetic changes within our body that may be leading to a form of a disease, is that that's why energy medicine works so well, is that we are 99.9999% energy and 0.0001 matter. And so given that we are just this huge energetic being, everything that we do, everything that we bring into our body is energy. And so with energy, we also need to have a direction for that energy to go. And that's where positive and negative poles start. So like, for example, the top of our head is a positive pole, the feet are negative. The palm of our hand is a negative pole. The back of our hand is a positive pole. And so lymphatic systems, blood, water, everything is either drawn to that negative and the positive. And a trick that most people don't understand is that this is where Feng Shui comes in as well, is that, you know, when I see people who have cardiac issues, if their bed is, the head of the bed is facing north and they're laying down, then oftentimes they're getting more heart conditions, more cardiac issues because they are facing towards the North Pole. And so all the blood rushes to that side or rushes to the head. And so therefore they get that high blood pressure, they get a lot of that stuff going on. And so switching it from east to west helps a lot with addressing those kinds of conditions. So the same thing goes with our own energetic being. And so there's a really easy test that we can do to identify if our polarities are intact. What I see in my practice is that a lot of people have medically complex issues, lots of medications, surgeries, exposure to radiation, exposure to x-rays, Wi-Fi, EMF, 5G, all of those. And that throws off their polarity. So when I hear somebody that may not be making progress on their patches, the first thing I always do with people is I check their polarity. So there is a way in which you could check that. And when you can correct it, which is a very simple process, it's just really working on the whole system to get it back into alignment with those polarities, then everything will start to work better. There's some people who don't respond great to energy work. Well, that's probably because their polarities are off. So correct the polarities and then they'll get that progress. So correcting those polarities, making sure they're drinking their water and all those things. Now, why this patch works so well is with the acupuncture system. Now, for people who don't understand what acupuncture and the meridians are, it's like if you look at an irrigation system, we have this PVC pipe that transports water from one spigot to the next. And when we get a clog on one end of the spigot, then all the water that's going towards that clog gets gets compressed, and then there's a lot of energy, there's a lot of pressure going on. That's similar to what is going on with a acute condition. When we have an acute condition, everything is going into the body that is racing to try to correct it and all that. When we release that clog, then the water runs smoothly through that system. Now on the other side, let's say that on the opposite side, where there is no clog and it's running through, but on the other side of the clog, the plant isn't getting the water. And so therefore it starts to atrophy, it starts to fatigue, it starts to die. And that's what happens in chronic conditions. And so the idea is that we want to open up that whole irrigation system, which is our meridians, and allow that energy to flow. Now, the way we identify that is what is the function of the organ and where does that meridian run through the body? And so if you look at what is the function of the lungs, it's for respiration, it's for breath, it's for oxygenation, it's clearing, but it's also susceptible to cold, like phlegm, pneumonia, things like that. So we look at different ways as far as addressing that. But also the lung meridian actually starts up here in the collarbone, and then it runs down the inside of the arm, and it ends at the thumb. And so you can look at all the different types of conditions that could be appearing along that lung meridian, and then you can address it that way too. So like, for example, arthritis, a lung meridian would be a good place for that. Like lung 7 would be a good point to use for that because it's right on the wrist. So there's lots of different things that we could do with that. So it's looking at some of these things as far as what's the function of the organ, where does the meridian run through, and then it helps us identify it. And what I like about it is that these meridian systems, they don't have a lot of resistance to them, so that when the patch is applied to these meridians, that energy flows through so nicely. Now, for example, I'm wearing the glutathione right here, which is on the conception, or this is the conception vessel. The conception vessel starts down at the perineum and it goes up the body. And so when we want to clear polarities, we go opposite that direction and try to clear that flow. Now, if you think about conception vessel, it helps with conception. So think about reproductive hormones, things like that. That's when you would use the conception vessel. The governing vessel is the one that goes in the back. And we like to put that X39 on the back of that one, like at C7. And that is really good because it governs, think about it, governs the brain, it governs the body, it governs the neurological system. So that's why I love this system, is because it's using magical medicine to get it to course through. And it's absolutely phenomenal when we combine the two.
We're just normal people and not doctors, but David obviously understood these meridians, because the booklets,
Yes.
the instruction booklets give you like, you know, one place, but sometimes 4 per a patch, which tells me that he's telling us the meridians based on the patches. I think in a nutshell, that's what that means. Yes, doctor?
Yes,
Yeah.
and what I really like the most is, as I was looking at some of his points, he's using some that are like what we call master points, very powerful points. And that's usually where meridians cross each other, why they make them so powerful. So you're actually addressing several meridians at the same time with some of these points.
Wow.
So,
I just
a
got
lot of
chills.
really good information. Yeah.
Really quickly, if
Yes,
it's okay.
doctor, of course.
So because of what Dr. Vienna just said about using big acupuncture points that cross big meridians throughout our body, right? All of our clinical studies were done using these patches on those locations that are in the instruction booklet.
Yeah.
And so when we talk about a patch, we don't just say it does this. Like when you listen to David speak on an hour webinar on a patch, you have pages of notes of what all that patch does. Like you can say, well, carnosine's a big antioxidant. Well, it's great for your blood sugar. It's great for your brain. It's great for your heart. It's great for your muscles. It's great for your connective tissues. Well, how can it do all of that? Because when you apply it to these acupuncture points, it targets all of these things in a massive beneficial way. So you could say, well, you know, what would you recommend for, you know, someone that has these type of symptoms? Well, this patch. Well, what would you recommend for someone that has these types of symptoms? Same patch, but they're totally different symptoms because of exactly what Dr. Vienna just explained. It's genius, literally genius.